We're here at HIMSS and we're in Vegas and I'm super excited. I have Julia. Will you introduce yourself real quick?
Absolutely. So my name is Julia Komissarchik. I'm CEO and co-founder of a company called Glendor. We're based out of Utah. My personal background is AI. I've been in AI for 20 years. I have 10 years patents. And the company's focus is how to protect patients' privacy while empowering data sharing. And thank you for having me.
Well, thank you for coming. We're so glad you're here. And this is serious. I mean, we were talking in the green room, talking last night about the difference. Will you just go into that versus, getting someone's social security, the cost of that on the dark web versus a health record information?
Yeah. So we're dealing with a couple of things here. One of them is for data privacy, is that if we look at the research done on dark web, if somebody wants to buy my social security number, it will be 30, 50 cents. If somebody wants to buy a medical record, it will be $250 to $300, 600x. And there's a reason for it. There's logic behind it. Credit card, status comes and goes, things go up, things go down. But when it comes to medical records, that's if somebody had a childhood disease, they will have that childhood disease. If somebody had COVID, they would have had COVID. And those things are highly personal and unfortunately highly actionable in terms of blackmail, discrimination, etc. So it's very important to protect patients' privacy. And once the data is released, there's no way to get it back.
Yeah. I'm excited because you are a classic, super smart, solving problems engineer. And I know you had a former life doing a lot of engineering. Tell me about that. Where were you before healthcare?
Primarily in artificial intelligence. So I worked in speech recognition and NLP, in search.
Mm-hmm.
One of the projects that I've done is to work with Wikipedia on a so-called "Did you mean" capability, and that was a lot of fun.
Yeah.
Because Wikipedia supports 300 plus languages. So the methods that we developed had to cover all the languages of the world. That was a blast.
So basically, if it wasn't a rocket scientist, I mean, what you do, the level of, necessary, what you're building, and I mean, because really your biggest thing is where you're sharing more with what you're doing is with this unstructured data, right?
Yeah, it's unstructured data and medical images, photos, videos, recordings like this one.
Yeah.
So in this particular case, for this recording, it would be a face identification, right?
Yeah.
But it's also such thing as voice recognition.
Yeah.
Not only what was said, but how it was said. And
Yeah.
that footprint or
Yeah.
Fingerprint can
Wow.
actually be used. So it has to be sometimes distorted, etc. But there are a lot of things to think about when it comes to de-identification.
So what are you seeing in HIMSS that's getting you really excited?
People are thinking about those two things. One of them is how to protect patients' privacy, and also the realization that if we don't share data, it's sort of, one of the ways to protect patients' privacy, not share anything, but it's not a solution.
Good.
Because if we look at something like ChatGPT, which was trained on publicly available data, billions and billions of pieces of information, and even ChatGPT runs out of data. When it comes to AI in healthcare, it has to be trained on medical data.
Yeah.
And the access to it is very difficult to get. That's why when you talk about two companies who are doing AI development, they all discuss the same thing. Where would I get data?
Yeah.
How do I make sure that I have highly diverse data?
Yeah.
Otherwise the models will not work.
Yeah. And would you share a little more, some exciting user cases this year coming through,
Sure.
what you're working on? I'd love to know more.
Well, there are actually quite a few interesting things. One of the things which all of us need is data lakes or data consortiums.
Yeah.
Because no single hospital will have enough data for any kind of AI training or research for that matter, especially when it comes to rare diseases.
Yeah.
So it's very important for all of us combine the data, have the representation of both large hospitals,
Yeah.
but also inner city clinics,
Yeah.
tribal clinics,
Yeah.
rural hospitals.
Yeah.
If we all come together, then this data will be accessible to the AI community, and as a result, the models will be reliable. Because right now, one of the challenges is that most of the FDA-approved models are installed in one location, which means they are not generalizable enough to be installed anywhere else.
Yeah. So what is our biggest opportunity and biggest challenge to make this possible?
Biggest opportunity is to share data, and biggest challenge is to share data.
Wow.
Big challenge because of the privacy, opportunity because once we do, then in my opinion, the industry will explode.
Yeah.
So there's so many things. Like one of my favorite stories is mammogram. People, every year there's a mammogram,
Yeah.
but actually it's possible not only to determine breast cancer risks, but also look at vascular disease. Because it's
Yeah.
the same thing, it's actually visible there.
Okay.
Same thing for eye exam.
Okay.
So there's so many things that can be done. What we are lacking is data to do this.
So how are you, like, you as the, tell me like a little bit, how are you working closely to on a practical level to do?
Well, on the practical level, we spent quite a few years developing the technology.
Okay.
Because every single modality, meaning videos, audio, everything else, requires different techniques, different technologies,
Yeah.
and different concepts.
Yeah.
For example, there's a scary story. Very few people think about it. So if we're talking about brain MRI or CT scan, it's actually slices of somebody's head. And the problem is that you can reconstruct the head and use face recognition to recognize the person. You can delete all the names, all the other identifiers, but the face itself will become an identifier. And that's just one of the examples of challenges.
Wow.
And that's for me as a mathematician very exciting.
Wow. So what do you you're a founder, you're a startup, but you're not new at this. You've been going through it. You're not tell us what you are really wanting to get any initiatives, share with our audience, kind of knowing more about your company.
A couple of things which I would love to talk about. One of them is we as individuals need to think about how our data is protected. At the same time, we as individuals need to think about how can we make sure that we contribute our data. Because if we don't contribute our data, the models that will be trained and used will not be applicable to us.
Yeah.
And that's very dangerous. At the same time, we work with quite a few states and others talking about how to create a data lake it doesn't have to be all combined in one place. It could be federated. But the important thing is de-identify data that will be accessible to everybody.
Okay. So that's kind of like your mission and vision.
Yeah.
Yeah, cool.
Yeah.
So how do people find you?
You can find me on LinkedIn. Our website is glendor.com. And please, if you have any questions, please reach out. And I will be happy to talk to you guys. Thank you. Thank you for the opportunity.
Yeah, it's been great to
Thanks.
have you on.
Thank you very much.
Awesome. Thank you.